Can you have ADHD and anxiety? And if you do, how do you tell the difference? Hi, I'm Dr. Jodi Gold, a pediatric and adult psychiatrist, here to answer the internet's biggest questions about ADHD and anxiety. Does ADHD cause anxiety? So ADHD does not biologically cause an anxiety disorder, but the symptoms of ADHD absolutely cause anxiety, actually for a large number of people. So being late all the time, being disorganized, forgetting to turn things in, not responding to important texts from friends, feeling that you're not living up to your potential can kind of cause anyone to be anxious. So therefore, if you treat ADHD properly, you might find that some of your anxiety just goes away. Can you have both ADHD and anxiety? So the answer is yes, you can have both of them. Actually, sometimes it can be hard to tell them apart. That's why having a good diagnosis is so important. Now, sometimes ADHD can make you anxious, and for other people, you can have both anxiety and ADHD. How can you tell the difference between ADHD and anxiety? So ADHD and anxiety really can look alike, and it can be a bit confusing because sometimes symptoms of ADHD actually look like anxiety and can make you anxious. So being late all the time, being disorganized, being distracted can absolutely make you feel anxious. On the other hand, people who have anxiety often look like they have ADHD. For instance, if they're forgetful and having difficulty focusing, sitting still, withdrawing, sometimes that will get diagnosed as ADHD when it's actually anxiety. So the truth is, it's really important to parse this apart and get a good diagnosis so that you understand whether your anxiety comes from ADHD or whether you have ADHD and anxiety. How do you treat ADHD and anxiety? Okay, so this is not something I can answer in 30 seconds. This is something that really needs to be parsed out carefully and probably needs professional intervention. Having said that, the treatment for anxiety and ADHD are quite different, but they're also complementary. If you have ADHD, it may be very important to start with medication and sort of a broader treatment plan of behavioral interventions and support. However, if we think you should be treating the anxiety first, you're going to want to start with therapy and lifestyle changes, and then think about medication as a second line. But the truth is that treating your anxiety will for sure help you with the ADHD because it'll allow you to be less anxious to deal with the symptoms of ADHD. And treating the ADHD may very well just lower some of the anxiety as you just feel more in control of your life. So again, it's really important to parse this out and to get help, but both of the treatments can be managed. Can ADHD medication make anxiety worse? So if you have a proper diagnosis of ADHD, then ADHD medication should not make your anxiety worse. But as I've been saying, anxiety and ADHD really do overlap. And sometimes the symptoms of anxiety mimic ADHD. In that case, the stimulant medication can make your anxiety worse. Where I see that quite a bit is with young kids, in particular boys, who may be hyperactive and are quickly diagnosed with ADHD, sort of hyperactive type, and are very quickly put on meds. And sometimes we see that the meds don't help them or actually make them worse. In those cases, some of the time, it's because the primary issue is not actually ADHD, it's anxiety. And that's why it's so critical to make a really thoughtful diagnosis before you begin treatment. By the way, if you're interested in learning more about ADHD and other learning and thinking differences, check out our channel. What is the difference between feeling anxious and having an anxiety disorder? So it's completely normal to have anxiety. In fact, it's actually part of the human condition. It can be very helpful. Anxiety helps us get up in the morning and get to work. It helps us to do our best. It helps us to stay on top of things. So the truth is that anxiety is sort of a normal part of our life. However, when I get worried about anxiety is when it begins to impair your life, when you're feeling overwhelmed all the time, when it doesn't go away. Normal anxiety actually lasts for the moment that you're in and then passes. An anxiety disorder often does not pass. You may find that you're anxious and overwhelmed all the time. At the point that you're feeling anxious, overwhelmed, not functioning at your best, that's the point where you need to actually get real help and support. Does ADHD make you more likely to have panic attacks? So ADHD does not directly cause panic or panic attacks. But I also want to talk about the difference between freaking out and having a panic attack. Freaking out because something's really scary in the moment is not the same thing as having a panic attack. A panic attack is something that kind of comes out of the blue. It usually only lasts 30 to 60 minutes. It's accompanied by an increased heart rate, maybe sweating, and you may even have fears of needing to go to the hospital or that you're going to die. It's a very intense, overwhelming feeling. If you're having regular panic attacks, it's really important that you get help. But I want to be really clear, ADHD does not directly cause panic or panic attacks. How can I help myself calm down in the moment? So it can be difficult to calm yourself in the moment. So let's just say you haven't turned in a paper that you're supposed to turn in, or you're freaking out about a presentation, or you forgot to RSVP to your friend's party this weekend, and all of a sudden you're beginning to get anxious. The first thing that I want you to do is to think about what you're feeling. Is it anxiety? Is it anger? Is it regret? You got to understand what you're dealing with first. The second thing you need to do is think about what's going through your head. What are these automatic thoughts that are going through? Then I need you to think about, is this really accurate? Or is my brain playing tricks on me? Is it possible that I don't have any evidence to support that my friend's never going to talk to me again, or that my boss is going to fire me? So the next piece is, once you've identified what's actually going through your head, and it's important that you're honest with yourself, then you need to be a detective and kind of sort through whether there's evidence to support what's going through your head. The next step is to sort of reframe the situation. Yes, I should have RSVP'd on time, but maybe if I call them up right now, it'll be okay. Or maybe my boss likes me and it's okay if my presentation's not perfect. I'll have another presentation next week. This shift helps you to get rid of this distorted thinking. And after you've shifted, what you want to do next is to check in and say, hey, am I still feeling anxious? Now, this isn't magic. I'm not expecting that anxiety is going to go from 100 to a 0 overnight. What I'm trying to get you to do is to go from 90 to 80, to realize that by looking at the way your brain plays tricks on you, you can actually decrease your anxiety. Hey, you made it all the way here. Thank you so much for watching. If you want to help make a difference, please like the video and subscribe to our channel. You'll support Understood's mission of making sure that 70 million people with learning and thinking differences like ADHD and dyslexia can thrive.